Hi, Ben Danielson here. I'm a pediatrician and I'm here today to answer your questions about the COVID vaccinations for young children under 5 years old.
With COVID cases being pretty low and the new variants not being as severe, does it make sense to bring my child in for a vaccine?
Oh, I am so glad about this question because I think I hear a lot that case numbers are lower now and maybe the importance of getting your child vaccinated is seem lower now than it was before. There's a couple of things we just need to keep in mind when thinking about this. One is that case numbers are actually on the rise. The Omicron strain has really had an effect on young people especially. A second thing to think about is that I think it's true now that a lot less reporting goes on. So it's actually harder to know exactly how many people are exposed, how many people are actually getting sick. So it's harder to say where the numbers really lie. It would be, I think, a mistake. It would be inaccurate to say that we're at some low threshold of cases and therefore we don't need to worry about it anymore. In fact, if we all thought that, the next thing you know, a few months from now, those cases would be at such high levels they'd probably surpass anything we'd seen in the last couple of years. It is true that the current variants that are out there do seem to be less likely to cause serious illness than some of the previous strains did. The other side of that is that they're actually seeming to be more contagious, especially in younger age groups. So there's still a greater chance of getting sick. And what that means when you look at actual numbers is even though they're less likely to get you really sick, the fact that they're more contagious might actually end up meaning, this is math, that more numbers of kids actually get very sick, despite the strains themselves being a little bit less intense. I hope that makes sense. I think it did. Yeah, I'm sure it did.